Good evening, everybody. For the people that don't know me, my name is Dr. Galimberti, and I work in a clinic called FemPlus Clinic. And tonight I'm going to talk to you about vagina and sex. So menopause is going to become much more interesting, and I hope you will enjoy that. So I hope you also have a nice glass of wine in front of you, because believe me, you're going to need that tonight. The first thing I'm going to do is I'm going to apologize for the title I gave to this talk. When I put out the post advertising the topic of tonight, I called it, "Do you have any problem downstairs?" And some of my patients got in touch with me and said, "You, of all people who have no problem in talking about vagina and sex, call it downstairs and you couldn't use the word vagina. What was that all about?" And the reason why we had to do that is that if I put the word vagina on a Facebook post, Facebook will block it. And the vetting is done by a computer. You cannot talk to a human being in Facebook. Believe me, I tried, even if you are trying to do a medical article. So we had to try to get a way around it. And we decided to use this word because it's something that you guys very often do when you ring up for appointments. Somebody will ring and ask for an appointment, and my brilliant receptionists will try to inquire on what is the problem that you're coming to see me for, to make sure they book you with the right person at the right time. And many of you would say, "Oh, I have a problem downstairs." And we know straight away that's definitely our area of expertise. You're in the right place. So I thought this would make very clear what the topic was about. And the other thing I want to explain to you is, why did I decide to give the vagina a chapter all by itself in the menopause talk? Because one of the previous talk I did was all on menopause symptoms, and the vagina gets a chapter all alone. Why is that? And the reason why I did that is because in my clinical experience, vaginal symptoms, especially the one due to menopause, are the big unknown for most patients. And typically what I would see is a woman coming to see me in her mid to late 50s with vaginal symptoms. And after she's been examined and I say, "Look, there's nothing wrong with you, it's menopause," the patient would normally say, "Oh my God, I didn't know this could happen." So it's something that many women unfortunately don't know about. And I would really to change that. I would like to make sure that you all know that this is going to happen, because it is something to happen to the vast majority of women in menopause, so that if you don't have it already, you can make a plan to make sure you don't get it and you know what to do. And if you have it already, then you can know what to do to fix it. We have to break this taboo of not talking about vagina. Women don't discuss their vagina when they go for a cup of coffee or a glass of wine. And I think that's wrong. It is something that you should talk about freely. It's a part of your body. You can discuss your hair, your nails. You should discuss your vagina as well. One of the things I very often say to my patients, this is a typical situation that happens. One of my patients will be on HRT, for example, and she's very happy to be on HRT. But when she comes to see me, she would say, "Oh, my co-worker, Mary, that works with me in the office," apologies to all the Mary, but it's the first name that comes to mind. "Mary said to me she didn't take any HRT and she's doing fine. She's on the other side and she didn't need anything." And now, first of all, you all know now that there is no other side, because menopause is forever. But I usually say to my patients, ask Mary how is her vagina, how is her sex life going? And if Mary doesn't get a heart attack, first of all, and she survives that part, you might find that her vagina is not doing so well after not taking HRT. So this is my introduction. What happens to your poor vagina in menopause? What happens is this, and when I talk about vagina, I need to clarify it's not just the vagina, it's the whole area that is affected by this. So that includes your bladder, your urethra, your perineal muscle, your vulvar skin. All these areas have a lot of estrogen receptors, and they're very, very much depending on being fed by estrogens. So when the estrogens go down, which you know it's what happens in menopause, the vagina is not very happy. And a few things happen. So what happens is this mucosa of the vagina, which is what we call the skin inside the vagina, that's what the mucosa is, will change. It won't be so stretchy and flexible. It will become very thin. It will become very sensitive to trauma, and that's why sometimes sex is very sore. and that's a big part of the problem. The second part of the problem is that also the vaginal pH changes. So your good bacteria, you all know by forever that you have bacteria in the vaginas and that you have a vaginal flora, and all these bacteria need to be there happily in a certain equilibrium for you not to have vaginal infection. So when the pH of the vagina changes, because the estrogen have gone away, then the good bacteria move out as well. It's a little bit like your teenagers, kids, or your grown-up kids that move out together with your bacteria. And what that means is that you're much prone to infections. So this is the physiology of it. This is what happened. The estrogen decline causes all these changes. But what it means for you is that you have symptoms. And when we talk about symptoms, there is a long list of symptoms, and I've done a little list of you for you to look at that I put up here, which is very important because when we mention vaginal symptoms, all women think this is just vaginal dryness. And they say, oh, I don't have that because I have a discharge. But that's not what it is about. The symptoms of the vaginal menopause problem, which we call vulvovaginal atrophy, include things like painful sex, recurrent bladder infection, recurrent vaginal infection. Some people have just vulvar discomfort. Some people have perineal pain, so pain around the muscle area. Some women have chronic itch. A lot of women think that have recurrent thrush and it doesn't go away, and all they have is this condition that we call vulvovaginal atrophy. So that's the picture, okay? And the important thing about these vaginal symptoms is they don't start at the beginning of the menopause. So they don't start with your hot flashes and night sweats. They start much later because it does take a certain amount of time for the lack of estrogen to cause these changes. So usually, if you haven't taken any HRT, they would happen in your mid to late 50s. They will affect everybody. This is really, really important because some women don't have bad menopausal symptoms. Some women have bad hot flashes, and some women just say, oh, I did very well because I don't have any of these symptoms. But the vulvovaginal atrophy, unfortunately, ladies, will affect everybody because it is a physiological change. So you cannot escape from it. I yet have to see a vagina of somebody over 60 who didn't take HRT, who doesn't have vulvovaginal atrophy. I never seen that in my life. So it does happen to everybody. Now, not everybody will have the same degree of symptoms, but the physiological changes will happen to everybody. And the other thing in relation to the symptoms is that unlike the other symptoms of menopause, unlike your hot flashes and night sweats that will eventually go, this symptom will not go away. It will stay there forever, and sometimes it will get worse with life and with time passing. Okay, so this is all very important definition and things that happen that you need to know about. So what does that mean for you? So if you just get these symptoms, is that something that is really dangerous? No, it's not dangerous. As I said, it does depend on the level of symptom that you have. Some people have more symptoms than others, and you have to decide what degree of symptoms you have and what type of help do you want to have, because what type of help do you need, because we are all different. Some women stop having sex in menopause and they don't have dryness or they don't have itch, so they're perfectly fine without treatment. Some women have been happily married for the same man and have been having great sex for 30, 20 years, and they don't want for that part of their life to finish, and it shouldn't have to finish. I also see a lot of women who start new relationships in their 50s because maybe they got divorced, and sex is very much on the agenda. So it's an important part that we can help them with. So like with HRT, it all depends on what you need. We are all different and we have different needs. But if you decide that you do want to do something about it, there are 3 things you can do which are going to be very effective. The first thing you can do is you can use a lubricant. And this, I think, is a must. It's a compulsory thing to do when you have sex in menopause. I say to women, never have sex without a lubricant in menopause. The same way you never go out in the sun without sun cream. It is something that you must do. And there are different type of lubricants on the market. There are some of them are water-based, some of them are oil-based or silicone-based. I do prefer the silicone-based. That's what I usually recommend to my patients for two main reasons. One, they're less messy, so they don't do a big squashy wet mess on you and on the bed, and they stay where you put them. And the very important point about the lubricants is you do need to know what to do with them, because some women get it given or get it prescribed even by the doctors, and they go home and they don't really know what to do. They put it a bit here, a bit there, a bit on the bed, a bit on himself, and that's not really the way to use them. So the way you use the lubricant is you put it on your finger. This is your vagina, and you need to coat the inside of the vaginal wall with it, because the purpose of the silicone lubricant is to create a protective film that will make sex not sore. That's what it is about. So it's like putting your sun cream on. You need to cover your vagina with it, okay? And one thing I also suggest, we keep one in the clinic. It's a German one. I don't particularly want to recommend the brand of it. The other, we keep it in the clinic for the simple reason the women like to come in for the checkup and get the lubricant and go home with it without having to go in a shop to buy it. But there are a lot of them in the market, and I'm sure they're equally as good, providing they don't have a particular ingredient that you're allergic to. The other thing about using the lubricant, which I think it's really important, and again, it's something I do say to patients, which seems very logical, but apparently it's not. You really should have a chat with your partner about this, because there is this myth that if you have to use a lubricant, you don't want to have sex, you don't have desire. And that's not the way it works. You do need to use the lubricant because you're trying to protect the skin of your vagina. So have a chat with your partner and tell your partner, yes, I do want to have sex, I want to have very good sex, and we just need to change things around a little bit, and that's what we have to do it this way. I think many men are not aware of this, and I think it's important that you explain it to them. Second part of your treatment after the lubricant is the use of vaginal estrogens. And this is really, really important, because vaginal estrogen are very much underrated by women and by doctors as well. What is vaginal estrogen? Is HRT? Yes. It is estrogen? Yes. But it's a tiny, tiny amount that you put in your vagina. And when you put a tiny amount of estrogen in your vagina, it doesn't go anywhere else. It doesn't get absorbed in your blood. It doesn't go to your breast, and it doesn't cause any other problem. So it is very, very safe. It is so safe that we give it to women who have had strokes, women who have heart problems, women who have had breast cancer. And they've done studies looking at how much of this product do you actually absorb. And if you use it for a year, the amount you can measure in your blood is about equivalent of about 1 or 2 tablets of HRT over a year. So that's absolutely nothing. So it is really something that is really effective, because the changes in your vagina are due to the lack of estrogen. If you put the estrogens back, the vagina gets better, the good bacteria come back, and things will gradually return to a much better and happier place. Now, 2 things about the vaginal estrogen. The first thing is a lot of women are worried about using them because they read the leaflet. And the leaflet in the vaginal estrogen is very old, number one, and it talks about estrogens in general. It doesn't really relate to the difference between the estrogen that you put in the vagina and the one that you take as a tablet. So it will mention stroke, it will mention breast cancer, it will mention all sorts of things. And I've seen a lot of women who would have used it, but then read the leaflet and stop using it. So please ignore the leaflet, throw it in the bin. It's a very safe treatment. And if you want some scientific data on it, contact me and I'll send you the literature on it. The second problem in relation to vaginal estrogen, a lot of women don't use it for long enough. So sometimes I see patients and they come to me and I say, yes, it is vulvovaginal atrophy you have. I prescribe the estrogen and they say, oh, I tried that already, it didn't work. Because they used it for 2-3 weeks and then they stopped. And that's not the way you use it. if you're going to use estrogen, first of all, you can't expect changes to happen overnight. It will take time, especially if you have had the lack of estrogen for a very long time. And the second thing is you need to use them forever. You can't stop using them. It's a little bit like watering a plant now that it's hot in summer. And then you decide, okay, I gave it a good water today. I don't need to do anything else for the rest of the summer. The same thing applies to your vagina and estrogen. You need to keep giving it to the vagina so that you maintain the skin healthy. And I think that's really it about the estrogen. So don't be afraid, ignore the leaflet, don't stop using them. The step number 3 in treatment of the vagina is the use of vaginal laser. And I'm really excited about this because this for me has been a total game changer in looking after vaginal of women in menopause. And I've been doing this for 25 years. What is the laser? It's basically the same principle of using laser on your skin, on your face. So laser has been present in the cosmetic industry for quite a while, and the use of laser generates new skin. It can do the same in the vagina and improves the quantity of collagen in the skin. That's why we use it for face wrinkles and things like that. And the same, it happens in the vagina. So I've been using this treatment for a couple of years now, and I'm really, really astonished by the results they give to menopausal women. Because the difference with using this and using estrogen is that the changes are much quicker. So my preferred way now, if somebody has very bad atrophy, is to bring them back to a normal level of comfort with the laser first, and then get them to use estrogen forever. And that way, they will never need the laser again, but the changes will happen much quicker than if we just try to use the estrogen for a very long time. Now, a couple of things about the laser that are really, really important. It's not cheap, it's quite an expensive treatment, and it's only available privately, but the equipment is very expensive, so that's why we have to charge for it. And the second thing is that there are different types of laser. And the first laser that came on the market is a laser called CO2 laser. And that's still used quite a bit. But there are a lot of FDA warning in America on the use of this laser, because the way this laser works is creating first a destruction of the superficial layers of the vagina, and then the vagina will regenerate. And the warnings are in relation to the risk of scarring and burning, which apparently has been a problem. Now, it doesn't happen to everybody to have problems. Some people have used it safely, but there's certainly some concern with it. And that's the reason why we decided not to go near it. And the laser we use instead is a laser called YAG laser. And the principle of action of this laser is completely different. It's a much more gentle heat, and it works underneath the superficial layers of the vagina, and it stimulates the collagen's growth. And it is a laser that is used on the face, and therefore that's why it's very safe, and it doesn't cause any burning. If it doesn't cause any burning on the face, it's certainly fine for your vagina as well. Sorry. And the very exciting thing about this type of YAG laser is that Canada Health, which is the equivalent of the FDA in Canada, has just last year, the end of last year, put this treatment on the recognized approved treatment for the treatment of vulvovaginal atrophy, which is a great step, an exciting step, because I hope that other countries will follow. And if that happens, that hopefully this will be available as treatment as a public patient, because it is really a great treatment. So just to recap, there's 3 things you can do. So one is your lubricant, which is really important, vaginal estrogen, which you shouldn't be afraid of, and also the use of laser. That's really what it is about vaginal treatment of menopausal vagina. Now, if you get any other information on other treatment, as I said about HRT, be very careful where your information comes from. A while ago, I wrote an article on vaginal dryness and sex in menopause, and a patient commented saying, oh, I use olive oil, I recommend olive oil for everybody. And I thought she was using the olive oil as lubricant, which, I said, yeah, probably that would work. It's oil-based, yeah, it would be okay. But what she meant when she explained it was that she was eating olive oil, so she was creating lubrication from inside. Now, this is the type of thing that there is no scientific information, evidence about whatsoever. in Italy, we consume liters of olive oil. And if this was true, no Italian women would have vaginal atrophy. And believe me, they do quite a lot because they go for treatment as well. So, be careful where you get your information from. A very important point on having sex once we've helped your vagina and made it better is what I explain to patient as the homework that you have to do. Think about it this way. We've helped your vagina, we've made the skin much better, and sometimes when you go on to have sex again, especially if you haven't had sex for quite a while, you're still sore. Because what happens is that you remember how painful sex was, and when you go to have it again, you go like this and you just contract your muscles straight away. It's a little bit if somebody gives you a punch and then comes near you again with the hand raised, and the first thing you do is you move away. So what we teach people to do is that once we fix your vagina, we need to teach you to get comfortable with your vagina again. And that's what I give as homework to patients to do. So if you've seen me about this problem, you know what I mean. Sometimes you can do that yourself. Sometimes you need a little bit of help with the physiotherapist, but this is a really important part of your treatment. Don't expect, if you have had painful sex for a very long time, the things will just bounce back without a little bit of more advice. So it's not just about the skin, but it's really important that you get comfortable with your own vagina again. And we can certainly teach you to do that. Now, one more very important thing about vulvovaginal atrophy, and this is my last very important medical point for tonight, is that we tell you you have vulvovaginal atrophy after we've examined you and told you that there's nothing else there, because there's loads of other things that can happen. So you can have cancer of the vulva, you can have cancer of the vagina, you can have dermatological condition. One particularly common is called lichen sclerosus, which is very common in your age group as well. So the diagnosis of vulvovaginal atrophy is a diagnosis by exclusion. We need to make sure that there's nothing else wrong first. And how do we do that? We need to examine you. So that's why I haven't moved towards this telemedicine video consultation that some women keep asking me to do, because very often we have to have a look at you. And it's not really possible to do that online. Actually, somebody sent me a very funny post on WhatsApp on gynecologists working from home, and I might put it on Instagram at the end of this for the crack, because you can all have a look at it and think it's funny. I thought it was hilarious, and you can imagine how a gynecologist would examine a vagina working from home. But you see the picture and you'll see. So that's why we need to have a look at you. And sometimes we have to take biopsy of the skin. This is something we do very commonly. If we see something on the skin that we're not very happy about, we need to take a little piece of tissue to examine and send it away and get it analyzed. But you have to learn to have a look yourself. And that's something that women don't tend to do. It's actually very easy. If there's something really wrong with your vagina, if you had cancer or abnormality of the skin, you will see it. But women don't have to look at the area. And usually what I see happening when somebody has a chronic itch or a chronic problem, it's a pattern that tends to repeat itself all the time. The first thing women do is they put a little bit of pseudocream on it, because pseudocream cures absolutely everything. I call it the cup of tea for the vagina, because when I came to work in Ireland first, no matter what was wrong with you or what was wrong with the patient, the first thing that is suggested is to make a cup of tea. So that's why pseudocream is the same. You kind of put it everywhere. And actually is not a very good thing, especially if you have a dermatological irritation. There's quite a bit of chemical in it, and it can make it worse if you have a dermatitis. And the second thing you usually do, you go to the pharmacy, because obviously the pseudocream didn't work, so you need something a little bit stronger. So you go to the pharmacy and you have a little wumble secretly with the pharmacy. And sorry, something went wrong with my computer there. And the pharmacies will usually give you a cream, which is usually an antifungal cream, because they tend to give the same treatment for all the itches. And if it's not a fungal infection you have, you're not going to get any better. And then your step number 3 is you go to your GP, who will very kindly usually offer to examine you. You couldn't possibly get your GP to have a look downstairs, so you much prefer if your GP hands a prescription without looking at you, and that sometimes doesn't work because it's not the right prescription. So you need to get used to have a look. Either you have a look or we have a look, but somebody has to have a look. And if you have a look yourself, sometimes you can have an idea what the problem is. Have a little look with the mirror. The only thing is, if it's the first time you look at your vagina, sometimes you get a fright and you see things that you don't know if they're supposed to be there or not. And in that case, come in and we'll have a look for you and hopefully reassure you. So this is really important because a cancer of the vulva and the vagina can happen. It's not terribly common, but it can present with chronic itch. And I've certainly seen in my medical career women who thought they chronic thrush and they had something more serious. Do never presume it's thrush. Do never presume it's vulvovaginal atrophy. You need to have a proper diagnosis first. Okay? This is really all the information I have to give you for tonight, but I want you to, after listening to me tonight, go out and start the vagina discussion. Start talking to your friends about vagina. The next time you have a girls' night, talk about the vagina, bring up the subject, break the taboo. If you don't do it, it's not going to change. I can only do so much, but you have to change the way we approach the subject. And if you do that, you will make it better for the next generation. You'll make it better for your daughters and all the younger generation to come. And the third thing, which is my final thing, last time I left you and I said go out and be fabulous, and tonight I'll say to you, go out in your menopause, be fabulous, and have fabulous sex. Okay, good night everybody. I'll talk to you soon.